Thank you, Presiding Officer. Like many in this chamber, I want to set out today my gratitude and sincere thank you to all health and social care workers who are and have been on the front line throughout this pandemic. Over the last number of days, we have seen on our TV reports from inside hospitals and in COVID wards where the level of pressure are laid bare for all to see. And that reflects the comments from the BMA Scotland Chair, Dr Lewis Morrison, who recently told the BMA members, "We have used the expression stretched to breaking point so often that there's a risk that the phrase loses its meaning." But that is exactly where we are at right now. So if there is an agreement in this chamber that we are all in debt to those workers, there should be equal agreement that we do all we can to ensure their safety as best as we can. And that should also apply to their pay terms and conditions. It's fine to say thank you, but we need greater than simply words. BMA Scotland have produced a briefing for today's debate where they raise concerns about the supply of effective PPE, and those concerns must be listened to and acted on. Given the levels of worry within communities, particularly amongst older people with underlying health conditions, it is also understandable that people are keen to know when they are likely to be vaccinated. The Government's amendment for the debate today talks about and notes that the supplies of the vaccine may be patchy in the coming months due to factors out with the control of governments. The First Minister earlier today talked about the Pfizer and the fact they were rescheduling the agreed supply, and I understood what that meant. But I would raise the question, have we got enough vaccine on order? What is happening with the Oxford vaccine and indeed the other vaccines that we'd hoped would come on stream? A patchy supply must be seen as a risk, and therefore the Government has to be more forthcoming on the degree of that risk. Why is there a risk? And most importantly of all, what are we doing to overcome that risk? So I do believe we need more detail so we can assure the public that the timetable we are working to in terms of rolling out the vaccine will be met. And we are confident that the numbers of vaccines required have been secured. I asked the First Minister a few weeks ago about the exit strategy, and she said, I quote, "The exit strategy now is the vaccine." It is very definite exit strategy that we have not had before. Therefore, the quicker we get people vaccinated, the more we can get back to normal. Given that answer, any risk to the supply must be addressed with the full power of government. But can I also urge the Government to recognise the need, once the COVID numbers have been driven down again, to get in place the most effective test, trace and isolate programme that today has not happened. So I would like to see the Government bring forward far more detail of the progress it's making on this front as well. Many have focused in this debate on the impact of prioritising COVID on other NHS services, and here again I believe there is a requirement on Government to present a clear analysis of the extent of the issues. The planning for building back on these services must begin now. We also have to recognise the need to put in place a national care service as part of that build back, and that will require actions to address the major failings in the current system. The Unite Trade Union has set out 3 clear actions that must happen in recognition that the backbone of the care service is the people who deliver that service. They call for the establishment of sectorial and national bargaining for all carers not covered by existing and agreed bargaining processes to ensure that standards are met and every carer receives the best pay and conditions. The development of a professional, skilled, user-responsive national care service to oversee and regulate the sector and ensure the highest standards are met and kept up in the sector. and that body be formed involving stakeholders including client groups, trades unions, employers, local government and Scottish Government, with a clear mandate to drive through the changes necessary to make the care sector in Scotland the envy of the world. Now, that is how we can learn the lessons and build back better, by putting care in the community on a level playing field with the rest of the NHS, taking the pressure off acute services by having world-class community services. By doing so, we will have learned the lessons from the first time round of COVID, and we will be investing in the greatest asset that health and social care have, that is the staff. Thank you, Presiding Officer.